President Cyril Ramaphosa has taken questions from the media in Cape Town today. Among the questions he faced is that of Health Minister Dr. Zweli Mkhize and Digital Vibes contract. The President said that investigations are currently underway. We are joined via Zoom by political analyst Professor Ivor Sarakinsky to unpack President Cyril Ramaphosa's media address this afternoon. A very good afternoon to you, Prof. Sarakinsky. Always a pleasure to see you. Thank you for being with us, sir.
Real pleasure, Flo, and good evening, listeners, viewers.
And just as a start, I just want to talk about, your reaction to the president actually now having this media address, what he's called a media engagement, where he actually did sit in front of various reporters and took questions, especially after, I suppose, some of the backlash that the president has received in the past about the fact that he doesn't, in fact, engage with the media as the media would like him to. I mean, what is your sort of initial reaction as he started to take those questions today?
I think it's a good practice to have a regular, weekly or fortnightly presidential meeting with the media where they have a free exchange of Q&As.
Yeah.
It can only be good in terms of transparency, accountability, and keeping the public informed. The rehearsed family meetings to discuss COVID are managed. There isn't engagement, there isn't questioning, and that's only works in terms of conveying basic information, but it's not good in terms of questioning and probing in terms of how decisions are made. So let's hope that this practice of an open-ended engagement continues and is regularized into the president's calendar.
Let's get into specifics. Obviously the sort of bigger question that was sort of posed to the president today was around a minister, of course, in his cabinet, Minister Zweli Mkhize. We've been hearing quite a bit, Prof. Sarakinsky, about alleged corruption and, of course, contract given to a PR firm called Digital Vibes, which have personal, people in there with personal links to the minister. Were you satisfied with how the president addressed that? I mean, there was a point where, I think they wanted to engage further with the president. Reporters wanted to engage further with the president on the issue, and they kind of stopped. I mean, what are your thoughts in terms of how the president addressed this question? He kind of just said, look, I am dealing with it, and I think that's where he left it.
I thought he didn't deal with that adequately or appropriately.
Yeah.
There are compelling and plausible reasons for the allegations being made about Digital Vibes and its association with Minister Mkhize. And that means that you can't just say that we're investigating and we're dealing with it and he's spoken to me about it and we'll take this forward. One has to be much more decisive on this. It's a really, really serious matter in terms of what seems to be patronage, corruption, and the distribution of scarce public resources to the minister's family in the context of a COVID pandemic that's hurting so many citizens. So much more needed than this. An indication of what would be done should the evidence be shown to be compelling and proven to be true in terms of a commitment to act. So not satisfactory at all.
Yeah, and in terms of you saying that it is a serious matter, which of course is what many people are saying, in fact, that it is indeed a serious matter. In fact, our reporter representing us there in that media briefing, Bulalani Philip, said, in a situation like this, one would expect, of course, that the minister, the health minister, either be suspended or on leave of absence. I mean, I have noted personally that, he's not tweeting in the last couple of days, for example. I mean, is that where you think it should be? Is that what the president's response should be at this time? And also, given the fact that we are right in the middle of the pandemic, and, we've had one consistent voice, we've had one consistent minister throughout. I mean, I wonder how that would kind of throw anything off in terms of our vaccination drives or anything that we're doing in terms of dealing with the virus. I mean, should he be on this suspension that was possibly raised?
Well, Minister Mkhize has made it very hard for President Ramaphosa. because in many other democracies, a scandal like this would result in the minister resigning, falling on his sword, and in that way protecting the prime minister or the president from having to take disciplinary action. So that's the practice that should be in place. But in South Africa, if that was the case, we would have ongoing changes in cabinet with all the scandals that are emerging through media investigations and the Zondo Commission. So the second best approach is for the state president to take some form of action. And this is where he's caught between a rock and a hard stone. On the one hand, he's got a minister who is a medical doctor, who knows what needs to be done under the conditions of COVID-19. On the other hand, he's got a reform agenda in terms of cleaning up the public service, which means a zero tolerance of corruption. And now he's got to balance the two in terms of making a decision. And what he seems to be doing is buying time. And citizens are getting impatient. There's more than enough time. And he has to act. And it might well be that Minister Mkhize has to pay the price for being associated with such malfeasance.
Yeah. All right, Prof. Ivor, thank you, as always, for speaking to us, and thanks indeed for giving us your time.